All right, so I'm going to start off with a little poll. I actually filled it in right away. And let me make it so everyone can see it. How many of you have downloaded an app? All you need to do is go into your text button, and the phone number, as if you were texting, is 2233, and then your text message is either going to be 97174 for yes, 97202 for no, and 97372 like I did for what is an app. So let's see you do it. Make it a little interactive. You guys have been very passive. The phone number is 22333. So 2 2s and 3 3s. And it's got to be in your text window. Nothing to do with healthcare. This is a really cool app by Poll Everywhere. You could use it anywhere, anytime, and interaction. I think it's kind of cool. All right, we'll give it another minute. Wow, 14 of you have voted so far. We're actually 13 and me. Wow. The third one is 97372 for what is an app? Like never heard of an app. Yeah, but I can't do that because we're using the free version, not the customized $9.99 version of it. All right, we'll leave it at that. So the answer basically is, everyone in this room has basically downloaded an app except for 2 of you and me who's never heard of an app. So that's pretty cool. All right, so let's go into presentation. So that's one good app. Another great app, if you're still using PowerPoint and you're not using Keynote, is a company called SlideShark. Download its free app, takes any PowerPoint, and it's the only PowerPoint app that I've found that works on an iPad that does not bastardize your slides and keeps them exactly the way you'd want them to keep. And I actually could look at my speaker notes as well when I do it. So a quick, it's called SlideShark. It's by the fine folks at BrainShark, SlideShark. So I've done my job. I've given you 2 apps that you can use. And it's amazing because most of the apps that you use for slides and your iPad kind of mess up your fonts and stuff. So watch, some of my fonts will be messed up today and you guys will go, what are you talking about? All right, this font is not messed up. It's just too much information on a slide. But I wanted to give you guys an idea of what Happtique was about before we get into a little demo. The sort of elevator pitch of what Happtique is, we enable providers, institutions, to deliver apps securely to their physicians, whether they're apps that they developed, whether they're third-party apps, or what we do is we curate the entire Android marketplace, the iOS marketplace, let's say the Amazon marketplace, and enable you, where they put them in just a couple categories, we put them into hundreds of categories and enable institutions to curate them on their own so they can deliver them securely. And if it's internal employees, bring your own device type of employees, not the employees that you supply a device with. We even wrap it with security, so if they leave, you get to pull back that app or update that app. But we sort of think that we live right in the middle of the 5 Ps. We originally created the company, we're all about the providers, the institution being able to deliver apps securely to their physicians. But what we found out really fast as we went into the marketplace is physicians want to be able to deliver apps to their patients, but more importantly, patients are coming to their physicians with lots and lots of questions, and we think physicians should be the ones prescribing apps. So think about it as if they would be prescribing Lipitor, they'd be prescribing a cholesterol app to go along with it. We truly believe at the end of the day, the third-party payers will reimburse for it, but that's as we grow. But as you think about what we're trying to build or what we're bringing into the marketplace is a way for patient engagement or institution engagement. The funny thing about our organization when we started is we truly thought we were this IT play about delivering apps securely. But as we got into the marketplace and started signing up a lot of hospitals, what we're finding is that we're a patient engagement play, and the patients are demanding it. Where 5 years ago, 6 years ago, a patient would walk into a doctor's office and say, I have a melanoma because it says this in WebMD. The physician could look at it and say, yes, no, or let's look at it. But now a patient who has diabetes is walking in, and just on iTunes alone, there's 250 glucose monitoring apps. Should it really be the patient's responsibility, or should it be the patient's choice to say, hey, this is a good one? The problem doctors have is there's no way they reviewed 250 glucose So somewhere in their formulary, either provided by the institution or through the institution, should be a way to deliver these apps. So that's basically Happtique. This is basically how our store works, mobile application management. It's downloaded, it can live on any device, really easy to use. This is what Apple basically takes it and puts it into two categories. We basically have curated with doctors, nurses, medical librarians, every single app that's healthcare related in iTunes. And if you go to iTunes today, they break it up into two categories, medical and health and fitness. We break it up into a ton of categories and also enable the institution to bring it to another layer. So then after we did all this, the institutions came back to us and said, hey, so you're enabling us to see the 250 glucose monitoring apps, but how do we know which ones work? We don't believe we ever should be in a rating space. The guys who just spoke, they should do the reviews, doctors should do the reviews, figure out what are the best apps. What we think the institutions and what we should be able to do is have a panel of doctors use outside physicians and make sure there's no malware, there's no security, and that the app does what it says it does. So in other words, the information didn't come from Wikipedia, and if it's a calculator, the calculator calculates. We think it's the FDA's responsibility if it's going to turn something into a medical device. But anything out of that, let us, or the organization, put that good housekeeping seal so you know it's been reviewed by several physicians or specialists in that area. And let the patients and the physicians be the ones who rate apps. Not like iTunes or other rating agencies do, where it could be the developer, it could be the mother of the developer, it could be friends. Let the people who specialize in it decide. The newest thing that we've added, and this came because institutions were like, great, now we need a way to deliver apps to patients. Today, traditionally, the only way a doctor can deliver an app or a nurse or a clinician to a patient is say, hey, go to iTunes, go to Android Marketplace, or hey, go to this web link and download it. So we built this patent pending technology that not only enables a physician to prescribe an app to a patient, deliver it, but if there's a formulary involved or a third-party payer, it can actually look which one's the right app and which one's a reimbursable app. That comes secondary, and that's our cute little Happtique man. And I'm actually showing you images. We're going to live on the edge off a wireless connection, and I'm actually going to go into our MRX product. We're about to do a pilot this summer. We got picked up by Forbes in 2 articles. There's been close to 8, 9 articles done on our MRX. Basically, we're doing this trial where we're going into the marketplace with cardiologists, diabetes doctors, and a few other specialties, and we're going to give them a subset of apps, and over like a 60-day period, we're going to see how many apps they prescribe and how many are downloaded by the patients. It's not a clinical trial. It's just to prove out that it helps patient engagement. So basically, what the doctor would do in a secure way, HIPAA-compliant way, would log on. So I'm going to go through. First time, they have to put their username and password. After that, it would know who they are. And I am. And they log on. All right, so I have 2 bars, so bear with me as I log on. Off my 2. We'll just show. All right, so I logged on. So I just picked a bunch of apps. These apps have nothing to do with anything, but keep in mind, apps could be HTML5 apps, they could be Android apps, they could be iOS apps. We want to make it across the board. So any app anyone develops, and they can even be videos, so they don't have to be just apps. So the first thing a doc would do is, and it could tie into any EMR, which is actually pretty cool. They would go to prescribe an app. Obviously, if I was tied into an EMR, I would know who the patient is. But in this case, I am going to be the patient. And Happtique.com. All right, and I'm going to go, all right, what apps do I want to prescribe this patient? I'm going to go, hey, I want to know his blood sugar. It's going to go in there. As the doc, I get to see all the information about it, or if the patient happens to be with me, I can show them what I'm going to be sending them. We also enable the doc to install it themselves so they can get it. And then it adds that app. And I'm going to do one more. I should be jogging more. And speaking about jogging, I got a Nike Fuel. I actually love the product. So someone was mentioned before that they had an issue with it, but I think it's great. And then I can write a note, Ben, you need to run. All right, and then I could send it to myself or prescribe it, it's prescribed. And then the doc securely can actually go in and look at its patient list and say, these are the apps I prescribed Ben. And you can see, I've downloaded 2 of the 3 apps they prescribed me, but not the third one. I could either have a program where it automatically resends them a message, or I could sit there and go, come on, Ben, it's time for you to download that app already. And I'm sending it back to them. In about a second, I'll get an email, pops into any device, doesn't matter what you're using. It knows what device you're on, and will only give you an app that's appropriate for your device. And let me go back to my slides. And then last thing I wanted to tell you about is we have this weekly radio show called mHealth Zone. The most amazing thing, we started 11 weeks ago. First week we had 120 people watch. Since week 3, we've averaged 2,200 people a week, and I think we've broken 14,000 views of our show, which is amazing for this 30-minute show that we do every week. That the first thing we do is talk about news in the industry, always do an interview, and the third thing, we bring a guy in from this company called App Authority. What they do is they scan apps for malware. You'll be amazed at some of the apps that everyone uses that has some crazy malware and security breaches associated with it. And then actually next week, we are broadcasting live from the WLSA conference in San Diego. And that's Happtique and everything you need to know in under 20 minutes. So.
Thanks, Ben. That was great, and I feel like I'm going very low-tech now to just simple text messaging. But I am actually a paediatrician, and I'm going to tell you about my text messaging program that I started at the health centre where I work. But one of the things that we've heard a lot from other speakers is how important it is to really know your audience and know who you're creating this program for. And so I want to start by explaining a little about adolescents. So I'm a general paediatrician and worked in general paediatrics for 10 years before finally kind of specialising in adolescent medicine. And why did I do that? I did that because I find them fascinating. Behind their kind of difficultness, there's a lot of complexities which, when you unravel them, just become fascinating. And so, that kind of pulled me in to this speciality. And they're important. They really are, what we do now with them is going to impact later in life. So it's a prime time to be making a big impact. And I went to a conference a couple of weeks ago, which the Lancet have recently done a kind of global review of adolescent health. And they showed that adolescent mortality has actually overtaken infant mortality. So, that's kind of pretty shocking, and it means that we really need to be addressing the risk-taking behaviours that adolescents have. Oh, sorry. That helps. Okay. So, so we need to, concentrate on preventative health measures. But we really need to understand adolescents before we can produce programs that help with this process. So adolescents at a time, it's not just they're not big kids, small adults. They're unique. And it's fairly recent that the sort of neuroscience has showed us that the brain actually continues to rewire right up until your mid-20s. And it's the connection between your prefrontal cortex and the rest of your brain which is the last to develop. And your prefrontal cortex is responsible for judgment, for decision making, for knowing the consequence of your actions. So, that puts this group of people at a very vulnerable time. And so that's why they're more at risk for risk-taking behaviours, both in their sexual health, substance use, mental health, a wide variety of things. And so preventative health is very, very important. So between 2008 and 2010, there's a big survey done, the YRBS, Youth Behavioural Risk Surveillance Survey, and it was 9th to 12th graders. And I just wanted to pick out a few figures just to kind of demonstrate the extent of risk. And they, just here, just looking at 30% of teens actually went in a car with someone who had been drinking alcohol, which is pretty high. And 8% of females attempted suicide 1 or more times in the last year, which to me that seemed a really high figure. Tobacco, we know that adult smokers, most of them started in their early teens, and particularly the ones who continue to smoke started at an earlier age. And here, the figure showed that almost 50% of girls had tried smoking a cigarette, and that's between 15 and 19-year-olds. And then alcohol and other drugs. 75% of females binge drink. And another really kind of notable figure here was of prescription drugs. That about 20% had used prescription drugs at 1 or more times. So, significant risk-taking behaviour going on. And, I'm highlighting this because what's so important is that we know that adolescents take risks, but we need to understand their developmental processes to be able to hit them with the right programs that are going to feed them the education and information that is going to change behaviour. And the last one was, obesity. It's the big killer, and it's a big one that we can tackle during the adolescent years. And it's not just what they eat; it's their physical activity. And 30% of females not taking part in an hour of physical exercise on any day before the survey, which is horribly high. So we need to be delivering health education that's developmentally appropriate, it's accessible, it's engaging, confidential, and importantly, it's trustworthy. So when I first started working at the Adolescent Clinic, it was just striking how many the teens were using cell phones. I mean, they all pretty much come in to see me and they've got a cell phone in their hand. I have to ask them to put it down, and they constantly going back to it. It's strikingly obvious. And we know Pew Internet Research, American Life Project has some fascinating figures, which I'm sure many of you know, that teens are just using their cell phones predominantly to text. So this is all very well, and there are lots of programs, and we've heard about a lot of them at this conference, but what we don't have really is the actual research going on, or outcome data from research studies that show that these things actually work. There's been a bit that's been done, but a lot of the studies are very small, and many of them are not randomized controlled trials, they're cohort studies. From the West Coast, they're the first to really talk about linkage to care, so sex info and hookup, connected teens to STD clinics. And they actually did show in a small study that it worked to a certain extent, that it's feasible. There are some hotlines which are now using texting. And another big thing where it's used is appointment reminders. But there's nothing that shows that appointment reminders really work. They're cost effective, but there's nothing that particularly shows that they work in adolescent health, where the no-show rate can be huge. And then compliance and adherence. So a big study was done by Pearson, which surveyed youth to see what they actually wanted. And the younger patients really did want medication reminders and appointment reminders. There's a big study done by Paula Costino, actually, in Brooklyn, looking at text message reminders for birth control. And she showed that, and this was a randomized control trial with about 900 patients, and she showed a 10% improvement of pill adherence at 6 months. And then there are lots of programs to do with health education, but these are largely feasibility studies, and very little that actually show proper health outcomes. And what we want to do is we want to change behaviour. And interestingly, Susan Wolford looked at using text messages in an obesity programme, and she found that when the messages are tailored to that particular patient, that they're much more accepting of those messages and likely to change behaviour. But what her study couldn't show is whether there was actually any behavioural change. And then the other thing that's really kind of emerging is using text messaging or technology to self-monitor. These two studies actually showed that patients were much better at keeping diaries, keeping journals of what they were doing when they used technology to keep those journals rather than pen and paper. So what does all this kind of tell us? It tells us that these programs are feasible, that we know that particularly teens are using the technologies, and there are multiple ways in which we can use them. But we really need to measure health outcomes and to see if they are changing behaviour. And someone mentioned it earlier, but there is a need for quality control. There was one study actually where they surveyed 29 websites, medical websites, and they gave 10 criteria for those websites to fulfil, and none of them did. So, that's really important, particularly for teens who don't really know where they're looking for good information. So that brings me on to Text in the City, which is a text messaging program for teens at the Adolescent Health Centre where I work. And this is a big centre which is non-profit, serving largely poor youth from South Bronx and East Harlem. They can come there without having to have insurance or having to pay. And we see between 10 and 12,000 patients a year. And so when I first started working there, I realised that everybody was using text messaging, and so I wanted to use it to educate my patients. So I launched this in 2009, and it had 3 functions. So a chat function, which is question and answer. So they can send in a question about anything, and they're guaranteed an answer within 24 hours. It's usually quicker than that. A health bite, which is a snippet of health education, which goes out once a week, and it covers a broad range of adolescent health-related topics. And then they can opt in for birth control reminders, and they can choose the time of the day that they want those reminders. It's totally opt-in, and so someone mentioned HIPAA compliance and liability, and obviously we had to have a lot of meetings about this with lawyers and make sure we were doing the right thing. But the bottom line is that we put this in the patient's hand to opt in, so it's their choice. And so there are just flyers in the clinic, and they can pick one of those up and just sign in. And then it comes to an online secure website, so password protected, which we go into, and we can see the thread of questions that are being sent in and respond online. And so, so it was launched in January 2010, and these are the 6-month figures. And this started really small because it was just me answering the questions. So it had to, we didn't know what the response was going to be. But as you can see, the main thing was the chat. So they were sending in questions. We had about 500 questions sent in the first 6 months. And then, I'm sorry about the text hasn't come out very well, but we then analysed the questions and coded the content, and we came up with 10 different domains, and the majority of questions were about birth control. And then when we break these down, it was about how to use the birth control, the effectiveness, and side effects mainly, which was really interesting because birth control is so complex, and we sit there with the patients and you can literally see them switch off and go into this kind of other zone because there's so much to take in that they just can't get it, and they're walking out of clinic with birth control in their hands, not really knowing how to use it. And we know that teen pregnancy is largely the result of failed birth control use, so it's a really important area to tackle. We also did a survey via text. It was obviously biased because those that answered it were the ones that were using the service the most. But it was encouraging. So 70% finding finding it extremely useful, easy to use, and 36% had used it more than 6 times. So what did we learn? We learned they use it. We found they wanted more functionality. So originally they couldn't choose the time of their birth control reminders, so we changed that. Originally also we were sharing a short code, and this was because of our tight budget. And that was cumbersome, and it led to lots of text messages going down the wrong route. So we now have our own short code. Importantly, to keep it really simple, adolescents span a wide age range from 10 to 22, and there's a large developmental spectrum. And so you have to take into account that a 12-year-old is not going to understand the same functionality as a 22-year-old. So just making sure that it stays simple. And what we have really found, as I keep saying, is that we need to measure health outcomes. So from this pilot, I've gone on to do a few more things. We've expanded the text messaging program that we have, and we've included immunisation reminders, appointment reminders, and we're about to launch a results via text. And then I'm also doing a study looking at delivering health education messages, particularly about birth control. So as you remember, most of the questions were about how to use your birth control method. I've gone on to do a study about that, which I'm going to talk about a little more in a minute. And then also using text message to link our patients that go to the emergency department to a primary care provider. So the birth control to you, the hypothesis is that text messages providing educational messages to girls initiating a birth control method will improve knowledge and understanding of their birth control, and so improve continuation of their chosen method. So this is a large randomized controlled trial, and they either get the text messages or they don't. And then we're looking at the outcomes of pregnancy, continued birth control use at 12 months. And the text messages largely dispel myths. They educate about correct use of the method, about efficacy and how it works, and inform them what to expect. So we hope that improving their knowledge is going to make them continue their birth control method. And I told you that's the outcome method. So we're looking at 3, 6, 9, and 12 months for continuation of the birth control. And then the other project, so from the ED to the PMD via SMS, we know that adolescents generally go to the emergency department to get their healthcare. So they're turning up at midnight for their STD screen, which is hugely inappropriate. And so we decided to collaborate, and we actually got a small grant to do this, and we will be sending text messages to patients who attend the emergency department who don't already have a primary care provider, and linking them to free or low-cost primary care providers in the community. So there's just so much we can do, and this is just text messaging. And 3 years ago, I did a survey in clinic, kind of looking at what they were using, and about, I think it was 94% had cell phones, but the majority were like old school, kind of dumb cell phones. And now I've just recently done another survey, and 95% have smartphones. So they are using apps, and so, but it's finding the right app that's going to be available for all of them that's the issue, and making it again developmentally appropriate. Having looked into lots of the kind of obesity apps, so weight monitoring, they're fine for adults, but a teenager finds some of those apps very, very difficult to use. So keep it simple. And the other thing is keep it engaging, and that's difficult. And I think with teens, thinking about kind of gaming and something that's going to really pull them in to be involved in their own health education. Riproad are the company that do our technology, so and they've been fantastic to work with, and just like to acknowledge some people who helped me in the clinic with this project. Okay. Thank you. Any questions?
So how many, over time, how many people have opted in to the program? And what's the retention? So, do you see people go in and out of this?
Yeah, we do. So over time, so now it's kind of lingered on. The pilot went on, and we're having to fund it, and I'm still the sole person answering the questions. So we actually have over 1,500 users of it, and we get about between 100 and 150 texts a month. And I know that there are still, we need to go back and see which cell numbers are coming up again now, but there are certainly the same users use it over long periods of time. And you can see that because what's great about our platform is that you can see the previous question sent in by a user when they send another question in. So, because quite often they'll send a question in that's related to a question they sent 2 weeks ago, and if you didn't see that previous question, you'd have no idea what they were talking about. So that's really helpful.
Yeah, what do you do about privacy? I mean, text messaging, is obviously public, and these are young girls. So, I mean, what happens when the phone goes off at dinner and it says, don't forget to use condoms the first week of the pill? And he goes, honey, what's that?
It's a good question. So that was one of the main concerns from the lawyers. And actually, the lawyer who was involved with all this had a teenage son, so it was a fairly tricky conversation. But she did come around to our thinking in the end. But one of the things we really do on the literature that we give out, we make a really big point of saying that this is your information and it's private, it's confidential. We suggest you put a password on your cell phone or delete the text message once you've read it. And they get sent a text message back out when they've sent in a question, again, kind of underlining confidentiality and security. And, then the other thing to say is, as I mentioned at the beginning, this is opt-in. So it's not as if we've taken all their cell phone numbers and we're just blasting out stuff to them. It's their responsibility to a large extent. Any other questions? Okay, thank you.
So my name is Robbie Freeman. I'm a medical surgical nurse at Beth Israel Medical Center. And I'm going to talk today about creating an app, a free app for nurses that's available on the Apple iOS platform, and the lessons that I learned with my first go at app development. So I like to start by saying I have no computer training. I'm fairly comfortable around technology, but before developing NurseNet, I was new to the iPhone, and don't consider myself a big techie. I hope the message you could take away from this presentation is that anyone can make an app. All it takes is a great idea or identifying a need and just a little bit of help. Okay, there was sound here, but I think that's not working. So my journey in app development began last year, around May, when I won an award for the Novice Nurse of the Year by a large nursing union based out of New York. So one of the great things about winning an award is the money that comes along.
Do you have another clip with sound?
It's okay. No,
Are you good?
yeah, that's it.
All right, sorry.
But along with the award, there was a few stipulations. It had to be used for something related to professional practice. So in the past, people have used it to go on conferences, tuition, continuing education, but one of the options was to put it towards a project or an entrepreneurial idea, and I decided that would be a challenge, and I was going to go that route. So I spent the next few months kind of thinking about ideas, talking to my fellow nurses and colleagues, And after talking it over, I decided I wanted to do a mobile app. Doing my research, I found that there are not that many apps available for nurses. The ones that are out there can be very expensive, starting upwards of $150 for the apps that currently exist. So there's definitely was a need. Nurses are the largest providers of healthcare, with over 3 million active registered nurses in the United States. That's of 2010. So there's definitely a huge need there. The iOS platform seemed to be the most popular for healthcare professionals. And just talking over with colleagues and my own personal experiences helped me form the tools that are included in NurseNet. And by the end of the summer, I had my concept. So I wanted to put 3 interactive tools that nurses can use to help them with their professional practice. The first of which was the abbreviation assistant, because we abbreviate so much in healthcare, and not knowing what an abbreviation means can be you can be missing a critical piece of patient data. And when you're missing patient data, patient safety is a concern, and you can't do your job as efficiently as you should be able to. So I started putting together a database of abbreviations, and by the time I finished, I had over 10,000 medical abbreviations. So the idea for the app was you type in the abbreviation you see, and it will populate a list. And with the next update, I've included those abbreviations that are approved by the Joint Commission, because they're cracking down on the use of abbreviations. Not to say they're not used, because they're still used all the time, but within the hospitals, they want to see less abbreviations. The next tool was the credentialer. Many of you who work in healthcare know that oftentimes you see an alphabet soup of letters that follow someone's ID card, or on a research paper, or on a business card, and you often wonder what a lot of those initials mean. So the credentialer, you type in the initials, and it tells you what they're credentialed for. And the feedback for this has been very helpful. It's been very positive. The last tool is the newsreader, and I basically compiled a list of RSS feeds from the top sources in different nursing specialties, and you get a list of recent articles that have the latest studies, the latest topics and trends. And it's just an easy way to stay current with what's going on this week in nursing, in healthcare. Nurses work long shifts, 12 hours. It can be very busy. Sometimes you don't even get time for a bathroom break or a lunch break. So anything that can make dissemination of information a little easier is a great thing. So the development phase. I spent about 4 to 6 weeks once I had my concept putting it together. I worked with a developer for coding, a graphic designer, and the databases I compiled myself, and same thing with the RSS feeds. I used an application called Pipes, and this is just a screenshot. And basically what you see is you put in your RSS feeds, and you can filter them by publication date, size, and this is how I was able to create a feed for each nursing specialty. November 7th, iTunes accepted my app. This is a screenshot of the iTunes page. So far, it's had great reviews, 4 to 5 stars. The total cost was just under $1,000, and that was relatively low. I tried to use local people here in New York City. I think that if I wanted to, I could have outsourced the coding and the graphic design and probably done this for about half the price, for about $500. And I just wanted to talk a little bit about the return on investment. So for for under $1,000, the price of an average conference, you can, I was able to create a free tool that helped deliver care more efficiently and safer. It helped start a dialogue for the potential we have for nursing apps, and I think that this is just the tip of the iceberg. there's a lot more room for growth. This was a very relatively simple app, especially compared to some of the apps discussed earlier today. But it's been great positive feedback, and it's brought some great media exposure to Beth Israel and Continuum. The Daily News earlier this year ran a half-page story on the app. The largest nursing publication, Nursing Spectrum, published a print article, and Nurse.com featured it on their website. I was invited to go on a local talk show, and these are just some of the media exposure that the app has received. It was tweeted by the Robert Wood Johnson Foundation and a few other organizations. And this is my plans for NurseNet 2.0. I'm already working on the next update. It's actually finished, and I submitted it to Apple 2 days ago, so it should be up shortly. What you see here is a screenshot of the new version. I included common lab values, and also, most importantly, I included Facebook and Twitter integration. So when you're reading an article, you want to share it with your friends. I know it's been discussed over and over during this conference, but as healthcare professionals, the public, our friends, our patients look to us for information. And it's our responsibility when we see quality information, new studies, trends and topics, to get that information out there. And this is just an easy way to do that. So in conclusion, for a relatively small investment, I felt like I was able to get a large return by helping over 30,000 nurses so far have downloaded. 30,000 users have downloaded NurseNet, and it's been less than 6 months. I think there's still a lot of room for growth. The younger generation, people are choosing nursing earlier. The Gen Xers and millennials are really comfortable with this technology, and I think that we need to encourage developers to develop programs that are going to lead to better patient care delivery, to help the frontline bedside nurses do their job more efficiently, increase patient safety, and that's pretty much it. That's NurseNet. Any questions?
How did you find your coder and designer?
Networking. So the question was, how did I find the coder and designer? And it was just talking with friends and networking, friends of friends, basically.
How long did it take from beginning to
Well, once I had the concept, it took about 4 weeks from concept to development. It was pretty quick. Any other questions? Thank you, guys.